The title is Therapeutic Adherence in the Digital Age, a validation process of an assessment, by Sabrina Grigolo and Sarah Croce Rachele Rocco, who works at the University of. What is the problem? Non-adherence to treatment is one of the most common problem patients suffering from a chronic disease. This phenomenon is often underestimated, and to prove it are the data of the World Health Organization, according to which about half of the population doesn't respect the continuity of their therapies, mainly cause of increase in healthcare costs, comorbidity of the patient general condition. Adherence to treatment is not determined only by the patient predisposition to follow medical prescription, but it's a multidimensional phenomenon characterized by the influence of the social-economic dimension, the complexity of the therapeutic regime, and personal factors such as culture, expectation, and wishes of each patient. From the nursing point of view, it's therefore important to understand what the patient believes are about his pathology in order to improve his adaptation to chronic condition. We know that in Italy, multimorbidity affects 1/3 of the adult population. The increased prevalence of multimorbidity has led to new health needs, with the definition of the so-called complex patient identified as a person with two or more chronic conditions in which each of these medical conditions can influence the outcome of other concomitant pathologies. So we can say that the elderly with multimorbidity represent an heterogeneous category in terms of disease severity, functional status, prognosis, and risk of adverse reaction. As for Italy, in fact, in the European Commission Digital Economic and Society Index, it ranked 25 out of 28 EU member states, with a score about 9 points lower to the EU average. Digital prejudices are also not be underestimated. It starts from the idea widely spread in society according to which men and women, having reached the time of old age, must step aside. After all, what could older analogs share with young digital natives? Analyzing the literature, no comprehensive tools were found for assessing adherence to therapy and digital skills for the chronic pluripathological elderly patient. The need to build an ad hoc start the validation process through the active involvement of the patient. The questionnaire on adherence to digital therapies and technologies was identified, which would help answer the following research questions. What is the compliance level chronic elderly patient in polypharmacy? Which aspects of pharmacological treatment does the patient find in more difficult to adherence to? The socio-demographic characteristics, the level of education and digital skills after compliance. Objective of the research to validate a tool for assessing the level of the adherence to therapy and the use of digital system in order to improve adherence itself. Materials and methods. The construction of the survey tool would have analyzed the daily habits of patients, the use of electronic devices, and educational perspective. The patient in question has to be at least 75 years old, be treated in polytherapy, and be affected by multiple pathologies. The sample taken into consideration is also a convenience sample without recruitment, and patient involvement was based on availability and consent to research. For the construction of the tool, analyze of and review of literature was carried out, which led to the revision of the more risky medication adherence scale and of the care, uh, from which some questions have been taken that are still now in the investigation tool. The questionnaire then went through several phases in its realization. Generation of the item through careful review of the scientific literature of the field of assessment and similar experiences. Provisional elaboration of the questionnaire submitted to a panel of experts in order to analyze the validity of the content. Collecting feedback between expert and author by analyzing the validity of the assessment, administration to 15 patient informed and trained on the purpose of the questionnaire, who were asked to formulate an opinion on the comprehensibility of the item and therefore on the content of the question. Improved questionnaire take into account all the feedback from the same patient and other experts. Administration to 15.5 Opati patient, National Association patient and caregiver, inform and training on the purpose of the research. Analyze of construct validity. Results. The survey sample was analyzed by dividing it on the basis of some variables. Sex, age, pathologies, drug, educational qualification, residence. As regards adherence to therapy, it was found that the patient have a good patient-doctor relationship. Around 19% of patients have a family doctor who know the therapy in its entirety, and in the case of suggestion from a specialist about a change in therapy, 72.7% inform their family doctor. In respect to the continuity in taking drug, many patients also have a good relationship with the drug taken, as they rarely stop taking them. Around 64% say they never forget to take the therapy daily without interrupting its continuity on the basis of one's perception of health or due to the negative effect it may entail. It's same a good percentage of adherence to the therapy. The responses to the different items in this section indicate that on average about 22% of patients don't consistently respect their treatment plan. As regards the second area, namely the importance of educational path in the correct use of therapy and the ability to make decisions in a shared way with the expert, it emerged that for 91 around of the patient is very extremely important to participate in individual meeting with the expert at the health facility while following inside from your computer degree. Times is equally important for just over half of the people, around 55%. It appears that the patient's relationship with the expert is preferred if the person leaves this facility, but not everyone would reject the possibility of deepening remotely from their home or smartphone. In fact, 60 percent will consider the possibility of sharing information with the expert via online remote platform very useful. As regards the last area, digital skills, it appears that around 62% almost always do research on their pathology, and more than half of the patients evaluate the reliability on the sites, in particular women between 65 and 75 years old patients live in the north of country and choose with a higher education diploma degree. In the analysis information, therefore, the level of education and residence are rather determining factor. Furthermore, smartphone and computer are mainly used to search the internet for this information, and it's surprising that almost all of the participants learned how to use them on their own. The last interesting and important result consisted of 55% of the population who believe that the use an application on the phone in managing all their therapy, or at least in something, could be a fundamental help. In fact, it appears that those who can benefit from this use are the youngest patient among the elderly. Uh, in a further gender analysis, about 61% of the women would use an application respect the mean. The conclusions are: the questionnaire on the adherence to therapy and digital skills was designed specifically to assess adherence to drug therapy, analyze in particular the importance of the patient digital skills and the path shared with the expert. In the called digital age, there are already technological tools in use for the management of some diseases, but in our country there are still few elderly people who are starting to interface with this world. In the study, the aim was therefore to analyze the patient degree and compliance and the willingness to take a path that can lead to the management of disease, even independently through the use application recommended by your doctor. If we all contribute to reducing the generation gap, and above all, the digital different application could be used to educate the patient and to improve the dialogue between patient and doctor. Thanks to the smartphone, it would therefore be possible to help the patient to take medication as prescribed by the doctor. Using the medication, it would be easier to keep track of the pills taken, receive a reminder on which one to take, and not any symptom that have arisen. Using a simple lexicon is necessary for the elderly to become familiar with an unknown word such as the computer word. The simplest method to encourage learning of new technologies is to explain with practice. In all this, it's also essential to explain the risk associated with the internet. The person will have to learn as soon as possible to distinguish a trustworthy site from those risk, and become aware that you should never provide your personal data on the internet. In this case of using an application to manage their health, the patient will have to rely on the competent doctor.